Hello all, I am Dr. Karthikeyan. Cancer is one of the deadliest diseases known to mankind. We know there are various forms of treatment options available for cancer, chemotherapy, radiotherapy, surgery. But historically, there are instances where certain types of cancers disappeared without any of these treatments. So today we are going to see the 5 cancers which mysteriously disappeared without any intervention by the doctor nor the patient. Welcome to our channel Healthy Living by Dr. KK. Let's see the cancers one by one and we will see why these cancers disappeared without any treatment. Thirdly, how that reason could be a potential treatment option in the future for cancer. The first case, a 74-year-old female patient came to the doctor's clinic with skin rashes that wouldn't go away with any form of treatment. Her leg was covered with waxy lumps, eruptions of angry red and livid purple. Tests performed on her confirmed the worst possible suspicion, carcinoma of skin. Considering the age of the patient, the future looked really bleak for the patient because you cannot just dig away the cancer from the skin, nor radiotherapy or chemotherapy is a viable option. Amputation of the leg was the best possible option. However, considering her age, how she will cope up with artificial limb, how she will train to walk at this age, whether it will be effective for her. So when doctors were considering all these options, in front of their eyes, when the patient was in admission, within a span of 20 weeks, the carcinoma of skin just disappeared from the skin of the patient, just like that, just in front of the doctor's eyes. And the doctors were just astonished. How could this happen? How it can just disappear? Something like cancer in stage 3. When the patient was inquired whether she did anything special, she said, "No, I prayed to God. It is the act of God. It is hand of God which protected me." But however, doctors had different ideas. They wanted to know exactly what is the reason, which I will tell you later. Second, it's a case of a woman in UK who was suffering from infertility. Doctors were puzzled what could be the reason, and the investigation revealed a small tumor lying between the uterus and the rectum. So when they were investigating what to do with the tumor, meanwhile the patient got pregnant. So the doctors decided to wait. Miraculously, the pregnancy went very well. The baby developed very well. Pregnancy was normal, and after the pregnancy is over, again when the tumor was investigated, there was no trace of tumor to be found after pregnancy. The cancer has just mysteriously vanished during pregnancy. Third is a case of acute myeloid leukemia, which is a very deadly invasive cancer which can cause death, mortality very soon if not treated properly. But Dr. Armin Rashid in Washington University in St. Louis reports something different. He has recorded 46 cases of acute myeloid leukemia which regressed on its own. It appeared and then it just disappeared. However, there was relapse among those patients, some of the patients, but still, if you ask oncologists, 99% they will say whether AML can regress like that, 99% they will say it cannot be. They will say no, but still it happens. What is the reason? We will find out soon. Fourth type of cancer. See, this is neuroblastoma, a notorious cancer which is known for automatic regression without any form of treatment. This among the 5 cancers which I am discussing now, neuroblastoma is one cancer which can regress on its own without any form of intervention, and it usually occurs in childhood. And you see the above the kidney there is a cap, the adrenal gland. So that is the most common site for origin of the neuroblastoma. And secondly, it can arise in the spine and mostly occurs in children. You will see the abdomen to be big, huge because of the mass inside the abdomen. The neuroblastomas can grow very big. At the same time, the speed at which they came, in that same speed they have the property to grow down also and disappear. See the CT scan abdomen, same slice, the slice is at the same level, and you can see the regression of the tumor size happening over a period of time. So neuroblastoma is a very peculiar tumor which can dramatically disappear on its own without any form of intervention for some patients. Among the cancer cases I am discussing, this tumor, sometimes doctor has the tendency to wait. They tend to wait to start chemotherapy to see whether the tumor has the tendency to shrink by itself. In fact, the article reports that there are 3 cases where even the metastasis occurred to the liver and to the skin. Even in those cases, these lesions have spontaneously disappeared and the patient got cured from neuroblastoma without any intervention. But the problem here is the decision to sit and wait is not so easy in a cancer case, because cancer is something which can fast spread. It can spread very, very fast. So the decision to wait is a very, very, very difficult thing to take for doctors as well as for parents. Sometimes the parents may think like, oh, my child, without any intervention, if there is a possibility, let me wait. So the parent may get some temporary relief. Suppose the tumor spreads very fast and there is no chance for, there is no tendency for regression, reduction in size, then it is a pathetic situation, is it not? So it is a very difficult thing to do. So it is very important now to clearly understand what is the reason for this disappearance act of some of these cancers. What is the reason for their vanishing? The last fifth one we will discuss, and from there I will take you through the journey of how this happens. This man, William Bradley Coley, he observed neck cancer in a patient, and that patient had a very huge neck cancer. But after some time in his hospital, this happened 100 days before. Okay, after some time, the patient developed a very high grade fever, extremely high grade fever with skin eruptions, and it was difficult. Like already he's having cancer. Suddenly this fever also came. So people were worried, but he was given treatment for reducing the fever, and he recovered from fever. And after the fever recovery, mysteriously, miraculously, the neck cancer disappeared. And now this man, Coley, he thought fever is the reason for the disappearance of cancer cells. So actually he tried this, fever in cancer treatment. So he tried to artificially induce fever. See, what is the mechanism behind this thing? Our body has a natural immunity. The natural innate immune cells, their work is to protect the body against foreign infections. And he tried to emulate this. And see, 90% of the cases where there is spontaneous remission of cancer, the patient has suffered from one form of infection or another. Like they had some sort of infection on fever, and then they had the remission. In 90% of the cases, infection could be diphtheria, gonococcal infection, hepatitis, influenza, malaria, smallpox, syphilis, because I am telling about 100 years before. So it is not the microbes which cause these infections that is responsible for the healing, but our body has these antibodies which are actually sleeping in a cancer patient. When an external infection, when an external microbe enters the body, and when our immune system gets this signal, oh, some foreigner has entered our body, we have to attack him. So all soldiers get up, and our immune system just gets up, and it tries to attack all these foreigners who have entered our body, all these virus or bacteria. So in this process, when they kill the virus and bacteria, they tend to kill the cancer cells also. So this is the hypothesis behind the disappearance of cancer cells. In fact, there is an American startup called PrimeVax. What they are doing is they are trying to artificially induce this infection. They found among these bacteria and viruses I have listed, dengue virus is the best possible option, because there is not much of mortality with dengue fever. Most of them recover. 95% of the cases recover in 5 to 10 days with fever and body pain. So better we induce this artificially, externally into the patient's body, this virus, and let me see whether it is curing the cancer cells also among these cancer patients. They are trying this. Nothing has come up with a proven benefit, but still it is a excellent option, is it not? Here I have to say one more thing. In neuroblastoma, the mechanism is found to be something different, because the neuroblastoma, it is from the nerves. The nerves need NGF, something called NGF. It's a nerve growth factor which is needed for their growth. So when the neuroblastoma, when the nerve cells, it is basically the type of nerve cell, when it multiplies uncontrollably, it needs energy for its multiplication. If there is no energy for its multiplication, naturally the multiplication of the cancer cells will stop. So the deficiency of NGF after a certain time, nerve growth factor, is hypothesized as could be a predictor, could be a reason for regression of the neuroblastoma. That is another story. But in most other cases of cancer, automatic cancer remission, infection and fever is found to be the most important reason behind this remission. So we all know how this chemotherapy is so painful, vomiting and hair loss and so many things patients suffer from. So chemotherapy is actually a form of immunosuppression. We are trying to suppress the immunity so that the cancer cells will not grow. But this is a reverse form of treatment where you are stimulating the immunity by inducing the fever or something, and then we are trying to kill the cancer cells also. So it's definitely a revolutionary treatment method, and it should come up in a proper way, in a big way. That is my wish. So it should come up in a proper way. But before ending the video, one warning to the patients is cancer is not something which you can decide upon yourself, and you can wait, and you cannot wait in home thinking that the cancer will regress. It is a very deadly condition which, if left untreated, if detected late, it can potentially kill very fast. Because of this video or anything from YouTube, never take your own decision. Just go to the doctor. Plain and simple, go to your doctor. If you are suspecting that whether there is any possible chances for remission, you can discuss this with your doctor. I will put the article link below. You can just quote this article from BBC and see these are the things, whether is it possible. You can discuss and you can take a decision with your doctor, not by yourself. It is strictly prohibited. With that warning, I am signing off. I hope this video created awareness among you regarding cancer. And if you like this video, press the like button. Kindly share this video with your friends and relatives to share this important message regarding cancer. Meet you all tomorrow in another interesting medical video. Until then, goodbye from Dr. Karthikeyan. Bye-bye.